Hi my dear friends, this is Dr. Rajkumar from Lifeline Hospitals welcoming you aboard onto this channel. Today I'm going to talk to you about the laparoscopic gastric sleeve. The gastric sleeve procedure is probably India's most popular bariatric surgery as we stand at this point of time in 2015. How did this happen? Interestingly, Michel Gagne, Dr. Gagne, was the man who invented this operation. He originally planned this operation as part of a two-stage procedure. But we found that even converting the stomach into a sleeve or into a long tube itself gave the desired effects of weight loss, and hence was born the laparoscopic sleeve gastrectomy. Somehow in India and in many parts of Asia, Korea, China, Saudi Arabia, it's become a very popular operation, and the main reason is that it is fairly simple to perform compared to the more technically challenging gastric bypass. In Korea, it's called a tube gastrectomy because we convert the stomach into a tube. Now, I'm going to ask you to sit back and think, if your stomach has a capacity of 3000 cc, which is the average adult human stomach, you can keep eating until the whole pot fills up with 3000 cc. Imagine if I only gave you a capacity of 100 to 150 cc. How much can you eat? You're not going to be having huge amounts of food if your stomach size is reduced to a small tube, and that is what a sleeve gastrectomy does. Now, in effect, it is a restrictive operation which restricts the amount of food that you eat. What will happen if you eat more? You can't, because if you eat a little bit more, you will feel like throwing up and you will therefore stop eating. Is this operation effective? Oh yes, it is. You can lose huge amounts of weight after the laparoscopic sleeve gastrectomy. Some of my patients lost nearly 100 kilograms, that is 220 pounds, only with the sleeve gastrectomy. Therefore, there is no doubt that its weight loss effects are comparable to those of the gastric bypass. Right. So, in whom would you do a sleeve? In whom would you do a bypass? Well, if you're young, if you're obese, and if you're not a diabetic, if you're not a hypertensive, you don't have metabolic problems like cholesterol and triglyceride, and very importantly in India, if you don't have heartburn, then you become a candidate for a sleeve gastrectomy. Although we now know that the sleeve gastrectomy has also got metabolic effects, let me tell you a simple mathematical sum. If 100 diabetics undergo a sleeve gastrectomy, up to 60% of these will get their diabetes back into remission. Whereas if 100 diabetics undergo a Roux-en-Y gastric bypass, 83 to 85% of them, in some groups up to 90% of those guys will lose their diabetes. So purely in the evaluation of surgery for diabetes, the sleeve is definitely inferior to the bypass. But for pure weight loss, the sleeve is fine. The other thing I must tell you, if you're planning a sleeve, is when one creates a long tube of the stomach, you may have severe heartburn or reflux after the sleeve, and that's why we don't do this operation for patients who have reflux. Overall, it's quick, it's easy, it's inexpensive, and patients are out in a day or two. As far as laparoscopic bariatric surgery is concerned, the tube gastrectomy or the sleeve gastrectomy has come to stay in this modern era. For more details on the sleeve, the bypass, bariatric surgery, or almost any form of surgery, please do come and visit us and subscribe to this channel. We'll be seeing you shortly.